Hello, everybody, and welcome to Annie Henderson's presentation on burnout in school-based mental health professionals. Annie is a school psychology graduate student, and this presentation will cover what burnout is and how it affects school-based mental health professionals specifically. Additionally, a discussion about identified antecedents and interventions for burnout at both an individual and organized level will be had. This presentation will last approximately from 2 p.m. to 2:50, and there will be a break for questions around 2:50 to 3. Please mute your sound and turn on your video if you're comfortable, and use the chat for questions if they come up while she's presenting. We're really happy to have you, Annie, and I think you have a slide telling us a little bit about yourself, so I'll let you get into it. Thank you.
Thanks, Molly. So my name is Annie Henderson, and I'm presenting today on burnout in school-based mental health professionals. And this is part of the UTTEC Lab webinar series. Just a little bit about me is I'm a second-year school psychology EDS student at the University of Utah. I'm also a second-year UTTEC Lab member, and I'm on the Ascend team. I got my undergraduate degree in psychology from the University of Iowa. I'm originally from a really small town called Butte, Iowa, and I have some special interests in rural mental health services and neuropsychology. And then I'm also a yoga instructor on the side. So just a fun fact. Okay, so burnout has been a really big topic, especially in the last 3 years since the beginning of the COVID-19 pandemic. It's really skyrocketed. And I'm sure that all of us have talked about it to some degree, maybe done a workshop on avoiding burnout, maybe seen Instagram posts or social media posts about burnout and preventing it and treating it and so forth. Maybe you've talked with your job or your school about it, whatever it may be. So why do we need to talk about it more? Haven't we said all that's needed to be said? And not necessarily, because tons of professionals are still feeling the symptoms of burnout. And in order to improve well-being and job retention in our fields, we need to keep talking about it. And as I go through this presentation, we'll see that their research dates back really far, and we just see trends going up with burnout. So even though we're talking about it a lot, we're not necessarily seeing a lot of improvement quite yet. Okay, so some of the main areas I'm going to be talking about today are defining burnout, symptoms and consequences of burnout, antecedents to burnout, and interventions to burnout. Okay, so defining burnout. I'm sure a lot of people have their own idea of burnout, and maybe you've experienced to some degree and you have kind of some definition in your head on it. So there's a lot of definitions to burnout too, but generally speaking, it can be thought of as a psychological phenomenon associated with job-related stress. It's kind of the most well-accepted definition in the research. It occurs when professionals become overwhelmed by the demands of their jobs, and as a result, they're unable to meet their own needs as well as their clients' needs. It's also been said to be a job-related stress condition or even a work-related mental health impairment. Okay, so the definition of burnout that we're talking about today has 3 dimensions to it. The first one is emotional exhaustion, and we can think of that as those feelings of feeling depleted, overextended, fatigued, exhausted. The second one is depersonalization, and this refers to the negative and cynical attitudes towards clients or work in general. And then a reduced sense of personal accomplishment or efficacy. And this involves negative self-evaluation of yourself with clients or overall job effectiveness. Okay, so some common symptoms of burnout, and this list is not exhaustive. These are just what have been identified. So negative changes in attitudes and decision-making, physiological stress, mental, emotional, and behavioral health, occupational motivation. Like I said, this isn't exhaustive, and these don't only affect the person who's experiencing them, but they can also really negatively affect that person's clients, their coworkers, maybe their family and their friends and more, because as we know, when problems that arise within us, they kind of tend to bleed into other parts of our lives. So I think it's important to realize that these symptoms might not just be experienced by the individual going through the burnout. Okay, so some consequences of burnout. Burnout has some significant consequences. And again, not an exhaustive list, but some of these are like compromised physical health, increased risk of mental health disorders, poor job performance, absenteeism, occupational attrition, so like leaving your occupation completely, and then low self-esteem. Okay, so by show of hands or like dropping an emoji or something, who has experienced some of these symptoms or maybe some of these consequences of burnout in the last year? You can just like drop a response emoji, or if you want to unmute, you can. Yeah. Yeah, so like mostly everyone. I know that I have, and I mean, even within like the last month, and for some people, it might be within the last week, or maybe you're feeling these effects right now. And this just goes to show how prevalent this problem is. The fact that, you know, everyone on the Zoom call is reporting some symptoms of burnout. Okay, so according to a study done by Schilling and Randolph in 2017, I thought these numbers were really interesting. About 92% of school psychologists had experienced a level of burnout. And additionally, looking at workers as a whole in the US, the American Psychology Association found in their 2021 Work and Wellbeing Survey that 79% of employees had experienced burnout in the month before the survey. And this was a 39% increase from 2019. So these are really high numbers, and it's likely that they haven't gone down from these dates that we have here. There's research on this topic dating back to the 1970s, and there hasn't been a decline in the amount of people reporting symptoms of burnout since then. And this could be due to the popularity of the topic or the increased awareness as a whole. But economically speaking, we also see effects of workers being burnt out, which I think is really interesting. So yeah, I'll get to that a little bit later. Okay, so what's causing this burnout? What is behind all of this? I'm sure we all have tons of reasons that we can name for ourselves personally. And if you'd like to, feel free to drop any of those reasons in the chat. But some of like the identified antecedents that we see in the research is we have high client caseloads, multiple job demands, role ambiguity, limited occupational support, rigidity of school systems, lack of resources, and unreasonable time expectations. The first few that I have with the asterisks are just the most cited reasons, and I'll dive into each of those a little bit more. Oh yeah, Dr. Fisher said compassion fatigue, and that's also totally really evident in the research. Expectations, yeah, thanks, Molly. One quote that I really liked from Maslach, which is, the demands of the work are high and the resources to meet those demands are low. And I think that like really encompasses kind of the reasons behind why school-based mental health professionals are feeling burnt out. Okay, so the first one I'm going to talk about is high caseloads. And the concept of psychologists and mental health professionals having high caseloads right now, I'm sure isn't very surprising. We hear about it all the time, but I still find this data to be really surprising. So the National Association of School Psychologists recommends that there be a student to school psych ratio of no more than 500 to 1. However, current data shows that ratio being about 1,200 to 1, with some states surpassing 5,000 to 1. So a really big discrepancy there in what we've identified should be the normal and what's actually happening. Okay, so here we can kind of see this broken down by state. This is directly from NASP. So that green line represents where each state should be at, that 500-to-1 ratio. And we see most states just not even being close to meeting that. I mean, we have a few that didn't report anything, and then it looks like Maine is doing pretty good, and then like we have Alabama up there is just off the charts. So here's the rest of the states. Yeah, we only see a few states even getting close to meeting recommendations. Utah is one of them, which is great. Yeah, Mississippi, some of them are really, really, really high. Okay, so for school counselors, it's not a lot different. The American School Counselor Association recommends a ratio of 250-to-1 student to counselor ratio. And current data is showing that the national average is 415-to-1. So yeah, not really meeting the recommendations here. Here we can see these numbers broken down by state again, with most states being over the recommendations. Here's the rest of the states. Yeah, we only see a few that are meeting recommendations or below. So a large issue with caseloads being so high per mental health provider is that it's not necessarily an easy, quick fix. It's a systems level issue that needs to be looked into further to determine if it's funding that's causing this, if it's lack of individuals pursuing these careers, if it's large numbers of individuals leaving the fields, and so forth. And in order to provide a solution, it needs to be uncovered what's really causing this huge discrepancy. Okay, so the next antecedent to burnout I'm going to talk about is multiple job demands. And this is one of the most cited causes of burnout in school-based mental health professionals. They often have to wear many hats and perform a large number of tasks, which these tasks may feel congruent and or incongruent with their job title. You hear a lot about school-based mental health professionals kind of like being roped into doing things that they wouldn't necessarily expect to have to do at their job and stuff, and this can cause a lot of stress. So if you just Google, what does a school psychologist do? You'll get a lot of answers. It's not very straightforward. None of the answers are simple. So it seems like it's kind of just a thing in the school psychology community that a lot of people might not even really understand what a school psychologist is. And even if you're in the field, it can be hard to explain. So it's no wonder why school psychs are having to perform so many different job duties while on site if like their peers might not even really know what their role is. So this image is just what NAF says a school psychologist will likely be proficient in. And it's like a long list, like data collection and analysis, assessment, progress monitoring, and then we have instructional support, consultation, family, school, community collaboration. And again, this is not an exhaustive list. This is just like a snippet of what you can find online. So another simple Google search of what does a school counselor do? And the answer is a lot. There's tons of resources out there that will list different things or that might not list the same things that are on this list. This is just from the school counselor website. So yeah. And then I also looked into what school social workers do because that's also another mental health provider. And again, a really long list here. Obviously, these lists are long, but yeah, they're not exhaustive and they might include things that in some positions, someone in these roles may never do. And some people may do every single day at their job, which leads me to role ambiguity. So role ambiguity is another very common cited cause of burnout. And this typically occurs when there's some conflict between organizational expectations and workers' expectations of job responsibilities and their autonomy. This is definitely something that I've felt before, and I'm sure it's felt by many others. So when you're in the role of a school counselor, a school psychologist, or a school social worker, you may often be assumed to be the expert in behavior or assessment or consulting or SPED evaluations, interventions, maybe counseling, therapy services, and you might be, but that doesn't always fit perfectly into each role. And depending on like the school you work at, the area you specialized in, maybe you have a BCBA credential, maybe the training program you attended had an emphasis on one thing or another. You may feel really comfortable in some of these positions, but maybe not all of them. And you may have a totally different envision of what your role should be that might not match up with your organization's expectations of you. Okay, so it's kind of ironic that mental health providers are supposed to be the ones treating others, but it's really hard to do that when our own needs aren't met. And job burnout can kind of become a catalyst of a really vicious cycle that will inevitably affect the field as a whole. So as more school psychs and mental health professionals in the schools leave the field, that means the workload is increasing for those professionals that are left over. So increased workloads, increase the vulnerability of those still working to suffer from burnout themselves, which leads to more professionals leaving the field and so on. So you can kind of see here that in the event of like someone's caseload increases, they start to have too much on their plate. We start to feel the effects of burnout, and then eventually they leave the field, and then the next person down gets that person's clients and so forth. So it can become a really nasty cycle. Okay, so who's really feeling the effects of burnout? We know that like the professionals are, but who's that really falling back onto? And it's the clients, of course. So if we aren't having our own needs met, we obviously can't effectively provide services to students. So that's why it's important that we actually tend to these issues instead of sweeping them under the rug and just simply getting by in our careers. I'm sure most people in these careers do care about their well-being and feel passionate about their work. But even if you maybe aren't concerned with your well-being, it's still important to care because ultimately it's the students who end up suffering. Okay, as much as I hate to bring the economy into the conversation of mental health, I think it's important because A, it gets people's attention who might not typically be drawn to this topic. And then B, it can actually produce really good evidence of trends. So burnout has been defined as costly and economically wasteful. And to put some numbers to that statement, as of 2021, the World Health Organization estimated that the impact of burnout could be translated to costing the global economy about $1 trillion, which is the number that I can't even like picture in my head, but I just know it's huge. And to add to it, the World Economic Forum found costs associated with turnover and lower productivity as a result of burnout to be about $322 billion annually. So these numbers, of course, aren't hyper-focused on school mental health workers, but I think it can really draw attention to the issue of burnout as a whole and how it can really trickle down into other areas and affect a lot more than, you know, just the individual experiencing the burnout. Okay, so what can we do about all of this? We know burnout's bad, we know it's happening. How can we help prevent it? How can we help mend those feelings of exhaustion and depletion that are coming up for us? So there's a lot of research that's been done on burnout. So there's also been a lot of strategies identified to help prevent burnout or treat burnout. And I think that the most important takeaway of this is finding something that really works for you and what makes your career feel enjoyable. I think that's really key. Because obviously, if you don't enjoy doing something and if it feels like a chore to cut it out of your day, then it's probably not going to be sustainable for you. So if you don't believe in meditation or something, then that strategy isn't for you, and so forth. Okay, so the first strategy is one that I really like. A big issue with mental health providers is that like one dreaded thing that you have to get done, and that's time sensitive. It's probably like reports or maybe a meeting. It could be, I don't know, finishing up an assessment or just filing paperwork, whatever that dreaded thing is that you don't want to do it first thing in the morning or right when you start your work. Because sometimes the strategy to prioritize what's important first doesn't totally work because it's all important. So doing it first thing in the morning, and we call this the eat the frog strategy. And this quote by Mark Twain, it says, if it's your job to eat a frog, it's best to do it first thing in the morning. And if your job is to eat two frogs, eat the biggest one first. And it essentially means do the worst thing first. And there's research that shows that this is really effective in increasing productivity and feelings of accomplishment, which I thought that was interesting that there's actually research on this and it shows that it really does work. Additionally, there's a strategy you could use. You could identify the aversive task or aversive tasks that you have to do that day. And then when you finish doing that, you do something to celebrate it. So maybe you like have a treat for yourself that you give to yourself after you do that aversive task. Maybe you give yourself like a 15-minute break to like, I don't know, like watch TikTok or something. Or you could collaborate with your peers on this or your coworkers so that you celebrate together. So you're like, hey, I got that one really terrible thing done. Like, woo, let's celebrate. And yeah, so forth. Just to make it a little more enjoyable when you do get that thing done. Okay, meditation and mindfulness strategies. These are really popular right now. I'm sure we've all tried something or maybe heard about it. It might not be for everyone, but some strategies that you can try and do to use these. Number one, schedule it into your day. I think a lot of people don't feel like they have time to practice mindfulness or meditation, and it really can be as short as 3 minutes. And then as you start to feel the effects, you can work your way up from there. For mindfulness tasks, it could be something as simple as journaling for 10 minutes, taking a walk, maybe like a mindfulness walk where you like notice the colors on the trees, or you see how many like birds you see, or whatever it might be. It could be eating without any other stimulation, like without looking at your phone or watching a video or without being around anyone. It could be coloring, whatever gets you into kind of a mindful state. Just put it on your schedule and treat it as if it's mandatory. With meditation, yeah, it's not like you have to sit there for an hour chanting Om with your eyes closed and like your legs crossed and everything. There's actually tons of meditation apps and YouTube videos. Some are as short as 2 minutes, and they can lead you through a guided meditation. So if you have like 3 minutes to spare in your morning, that's perfect. Okay, having connections in your field has been shown to be a great protective factor in preventing burnout also. It's not uncommon for a school psych or a counselor or a social worker to be the only one in that profession working in their school. So it's important to do the work to stay connected to others in your field outside of your immediate place of work. I know that like NASP has a mentorship program that you can join. And I would assume that like school counseling or school social work programs have some sort of group established for that as well. And it's just some like strategies you can use for this. You can join Facebook groups, you can find social media connections, you can join and participate in organizations like maybe in your community or maybe nationwide, maybe it's like NASP, or here we have UAS. Stay in touch with classmates and faculty, so people that you maybe went through your program with can be really helpful. And then plan times to meet with them regularly, which maybe it's just like a Zoom call once a month, or maybe you are able to like meet for like a happy hour or something. Maybe you just have a group chat that you all talk about things, you ask questions to each other, some way to stay in contact regularly. Okay, engaging in something that you feel passionate about. Adults who work in careers that somewhat define who they are, such as people who work in mental health and helping careers, they sometimes tend to lose sight of their personal hobbies and passions. And this is true for a lot of careers, but feeling passionate about the work that you do is protective against burnout. But if you're already feeling the effects of burnout and maybe you aren't feeling the passion so much right now, you can engage in something else that provides you with that enrichment that you might be missing. Something that you can like look forward to at the end of the day or at the end of the week. Maybe it's something that's relevant to your job, but feels more like a side project than a duty or a task. So maybe you're really interested in like SEL curriculum. That could be something that you work on the side that you feel passionate about in your school that might make work feel a little more enjoyable to you. Or maybe it's totally unrelated to your job. Maybe you take an art class or cooking class outside of your job. Maybe you redecorate your office or your personal space. But the most important thing is to make time for something that you feel passionate about and that you care about and that you'd like to project. Okay, leave work at work. I don't think this one is surprising, and I'm sure we've all struggled this to some extent. And it's really important to set clear boundaries and stick to them. It could be as simple as just letting it be known to your work and your organization or your clients that you don't respond to emails or texts after hours. Or you could do, I really like this strategy, like washing the day away or taking off the day. So like washing your hands as soon as you leave work, or washing your face or taking a shower, and like using that as a way to like envision washing away the day, anything that might have happened, like leaving it behind, you're washing it away. Or even like changing your clothes even immediately after work to symbolize like separating work time from personal time. It sounds simple, but like if you really think about it, sometimes I have found it to help for me, and it's been identified that it helps for others. Turn off email notifications after a certain hour. And then I think it's helpful that if thoughts are coming up about work after hours, you can write them down and put them in like a box or a bag or something so that you can come back to them the next day. Because I think sometimes we like spiral about thoughts. We're like, well, I don't want to do this right now, but I don't want to forget about it, so I have to do it right now. And this way you can remember it. You're like, it's there. I can come back to it tomorrow when I'm on the clock or when I'm not in my personal time and relaxing. Okay, so what you can advocate for as far as organizational change. We know that a lot of what is causing the burnout is an issue at a systems level. So as individuals, we can't totally control all of that on our own. However, we can advocate for change that we know can help. Organizational and environmental factors are found to be antecedents to individual burnout and should therefore be the appropriate targets for intervention rather than just solely focusing on individuals. Research has identified a long list of organizational antecedents to burnout, and it has also identified some changes that have been correlated with improved levels of burnout. So these are things such as increased social support for employees, increased employee autonomy and involvement in decision making, which I think is really powerful because I mean, we see with kids that we work with that empowering them to make decisions and to have some autonomy in what they do can be really helpful. And why wouldn't it be the same for adults? Teaching of communication and social skills to supervisors, providing regular supervision and peer supervision, promotion of self-care as a value within the system, such as like providing sick and mental health days, and then reduced role ambiguity by providing clear-cut expectations from both parties, and then also decreasing workloads. So long list. I'm sure this isn't everything that could help, but This is just what research has kind of pinpointed as things that have been tried and that have been found to help in the past. Okay, so this study done by Morris and colleagues identified a variety of targets and strategies that we can use for future intervention studies on burnout. We see these things are listed at an individual level. So things that individuals can do for themselves. And I think a lot of these aren't surprising, but it is nice to have like some data to back it up, such as like increased social support, increased positive stress coping skills, increased awareness, reduced numbing, all really interesting research ideas that could hopefully continue to be done. And then here we see things at more of an organizational level, kind of like what I was just talking about. Okay, so I think the takeaway is that burnout is often presented in a way that revolves around like self-care practices and such. However, it's important to recognize that the phenomenon of burnout is primarily a systematic issue, and it should be treated as that. So feeling burnt out doesn't equal self-care failure, although partaking in some self-care might still be worth it. It's important to have some compassion for yourself and know that it doesn't mean that you failed at taking care of yourself if you're experiencing these feelings of burnout. Okay, so does anyone have any questions or comments, concerns, worries, fears, doubts?
Do you have any examples of how you've let past employers or like coworkers know that you need them to help you out with any self-care type of things or just assistance?
I feel like it's helpful when like supervisors or higher ups and the employee are really upfront about how they want to discuss those things right off the bat, so that you know that like if you're feeling like really, really burnt out, you can be direct with your supervisor and say, hey, I really need like a few hours to myself this day, or we need to work on, changing around schedules or some sort of process. So I think that knowing how people receive feedback and knowing how people like to give feedback is helpful in establishing how to come up with some ways to fight burnout feelings.
Thanks, Annie.
Yeah, thanks, Molly.
Hey, Annie, I had a quick question. I was wondering if maybe you had any advice on, say you have a colleague or a coworker who's exhibiting some of these symptoms, and what would be like a tactful way to maybe bring up some of these conversation points and say, hey, maybe this is something that could help, or in not a harmful manner.
Yeah, totally. So I think first, like just checking in with them and seeing if they're going to endorse any of those feelings with you. And maybe even if they do just a little bit, but you might feel like they're kind of beating around the bush, you can ask them, be like, are you open to like maybe learning about some strategies about like helping with some of these feelings? You could say, this is what has worked for me, or this is what I've like learned. And if they're open to it, then maybe asking like, oh, great, like, are you interested in like mindfulness techniques, or are you interested in like trying this eat the frog technique, and just going about it in a gentle way. But I think first step is like just maybe checking in with them, even if it's a simple text, or like when you see them in person, like, hey, how's it going? Like, I haven't talked to you much about like how things are and whatnot.
Awesome. I love it. Thank you.
Yeah, I hope that's helpful.
I had a question, Annie. So I really liked your slide about like how much burnout is costing, and just like how it's tied to the economy. And I know in some places in Europe, they've been like experimenting with a 4-day work week. And I was curious if you found any like information about like changes to like economic systems in relation to like burnout, or like if there was any correlation between those.
I haven't looked into that, but I really want to now because that's super interesting.
Yeah.
Because, you know, a lot of like, the argument around not going to like a shorter work week would be like economic side effects. But I mean, we're seeing economic side effects from burnout feelings and people being overworked. So that's a really interesting point to bring up.
Yeah, I think it would be super cool to like explore that. And like, I'm just super curious about the 4-day work week and how that impacts like schools and like people's overall mental health well-being. So I was just curious, but thank you.
Yeah, I'm definitely going to look into that. Thank you, Rachel.
Rachel, I really appreciate that you brought that up. I think the flexible work schedule is such an interesting area that we really do need to explore, because I think, you know, you can like pay people more for their time, and that feels great. But that seems to almost always be like a temporary fix, because like if the work's still the work, or if you're like not getting that extra day to like do your laundry or to like take, you know, go on a hike or something, like it doesn't matter. Like all the money in the world, you still don't get to do those things. Yeah, I think that something like a work week reduction or like flexible scheduling or something like has to be the future. And, you know, me, I'm like a technology person. So to me, I'm like, that's the whole point. We have all this technology that we can reduce the work week. I don't even know if we need to necessarily put more time in the other 4 days. Like, I don't know how that looks, but I'm really curious about that too. Thanks for bringing that up, Rachel.
Yeah, I'm very curious about this, especially because a lot of the research that has been done hasn't like focused on like work time. It's been focused on like workload and stuff. So I'm interested to see if there's like going to be new research that comes up around time spent at work.
Yeah, because I mean, in schools, it's kind of like this is the time that school happens. So unless they shorten it to like 4 days instead of 5, like it doesn't change. An interesting thing that's related to this from the pandemic that I think was really worth bringing up was, I think it was maybe 2 years ago. Teachers were given Wednesdays as like a non-student day during the pandemic. So it was like Monday, Tuesday in person, Wednesday off, like asynchronous, like I don't know what the quality of that was, but that was the day. And then Thursday, Friday. And teachers loved that. They reported that their well-being was like almost like higher during that time of the pandemic, despite, you know, being isolated, because they had like a midweek like checkpoint where they could be like, whew, like, is everything okay? So I don't know. I think there'd be a lot of value in that. I think to make it work, because I'm sure there's critics who are like, oh, well, you know, you can't do it because childcare needs or whatever. I'm sure you could stagger in some way. So like 4 people work Monday through Thursday, and then some people work Tuesday through Friday. There must be smart minds who can like figure this stuff out, right?
Yeah, that's a great point. And yeah, I kind of, my mind kind of went to the same place. Like when we're working in the schools, you know, where do the kids go, or like what do parents do if we do shorten the work week? So lots of interesting content to look into there.
I also just wanted to say I really appreciated your presentation and how you talked about it being like organizational and systemic instead of just like another like, here's what you need to do to recognize like burnout in yourself. Because I feel like a lot of times these types of conversations are very focused on like individual, and it's like, what can you do for self-care to take care of yourself? And like, that's important, but it also sometimes creates more pressure on the person to like, now on top of like doing what I need to do, I also have to think about like, how am I going to prioritize self-care? Whereas like in your presentation, you talked about like things supervisors can do to like be proactive about it, so the pressure is not all on the individuals. So I just really like that and really appreciated that, Annie.
Yeah, I'm glad that you like that, because I did too. I think that there's also times where, you know, if you're feeling so exhausted exhausted and burnt out from your work, like practicing self-care feels like a chore more so than feeling like you're taking care of yourself. So there's got to be a balance somewhere. Okay, any other questions or comments? Thank you everyone for the really good discussion. Here's my references.
If there's no further questions, this video has been recorded and you can find it on the UTEC lab drive. If you have any other questions, you can reach Annie at annie.henderson@utah.edu. Thank you for participating in this webinar and have a good Friday.